All right. Hello and welcome to this morning or this afternoon or perhaps even the evening, depending on where you're joining us. Welcome to the public webinar for this lovely Wednesday. My colleague, Jenny Tecito, and I are going to be talking about the paradox of LSVT, a flexible approach within standardized treatment. This is something really near and dear to our hearts and something that's really important as clinicians, but also as patients to really understand the two sides to LSVT, that it is protocoled, and we'll get into why it is a protocol and the research behind it, but we'll also be really touching on how to make it personal and tailored for the individual. And so we'll be dropping into the chat the handout for you, and you'll also receive a copy of it in your email, but we will have that in the chat if you need to download it right now or today to follow along if you prefer. And so my name is Heather Hodges. I am a speech language pathologist. I'm also one of the LSVT LOUD faculty instructors. I wear several different hats, including continuing education administrator. I work on a technological grant. We're looking at improving voice recognition across devices for individuals with voice and speech changes, specifically those with Parkinson's disease. And I've been with LSVT Global in different capacities, I think now for 18 years. So it truly has flown by. I absolutely love being able to work with the patients, the clinicians. I can't believe how fast it has flown by because, as they say, time flies when you're having fun. And so we will have more information on our backgrounds, but before I get to that slide, I want to introduce Jenny, and she can tell you a little bit about her role within LSVT.
Hi, everyone. I'm Jenny Tecito, and you're going to hear from me in the latter half of the webinar today after Heather wraps up her topics. I am currently the Director of Innovation and Communications for LSVT Global, but I am also a physical therapist and worked in a neurological, mostly outpatient physical therapy practice for about 21 years. Where I was our lead for our team related to Parkinson's disease. And we did a lot of LSVT BIG treatment. I have been involved as a faculty instructor with LSVT since 2011 and have now been working full-time with them for the last 3 years. So that's a little bit about me, and I'll hand it back to Heather, and you'll hear more from me later.
Great. Thank you so much, Jenny. So, and I should also add to, in addition to my roles within LSVT, Jenny's experience reminded me, I should say, I did have experience for 13 years working in an outpatient setting and working really closely with LSVT LOUD patients. So here are our more detailed biographies for your reference. I won't go through the details of this slide, but if you want to learn even more about us, here it is in writing for you. With this being a webinar, we do also include our disclosures. And so our financial relationship or our non-financial relationships for Jenny and myself include a preference for the LSVT treatment protocols, specifically for LSVT LOUD and LSVT BIG as treatment techniques. We do also have financial relationships. I am a consultant for LSVT Global, and Jenny is an employee of LSVT Global, so we do receive lecture honorarium. As far as some of the nuts and bolts, the webinar logistics, right now microphones are muted, so that way we don't have to contend with any little background noises. When it gets amplified across, dozens of different computers, it can get distracting. So microphones are muted, which is important to know for later if you do have a question at the end of our presentation component of today. And so that brings me to the questions. If you have a question, there's a number of ways to ask your question. One is to type it into the chat if you're comfortable using the chat on Zoom. If the chat is distracting to you or it's something that you've never done, you're not comfortable with, that's okay. You can keep that closed, but Questions that do come into the chat, we will save for later in the presentation so that we can answer them all together for you. And sometimes questions that come up in your brains, you're forward thinking, and we're about to answer it in an upcoming slide. So that's also why we save those for the end. The handouts, as I mentioned, should be dropped into the chat. You should also be emailed a copy of the handouts of the slide deck that we'll be going through today. And there is a survey that will launch at the end of the session. We love to hear feedback from you as to what was helpful, what you thought, questions, or maybe future ideas that you have. And also there is the option, if you want to fill out the survey right away, it will launch. And then there will be also an email link to it if you don't have time immediately after the session today. So some information about continuing education for those professionals that are joining us today. This particular webinar is not ASHA or state registered for CEUs for speech, physical, or occupational therapists, but it can absolutely be self-reported CEU credit for non-registered or non-pre-approved CEU activity. And that's through using your certificate of completion. So if you would like to self-report for your continuing education requirements, you can send us an email. So those attending and watching today, here's instructions on how to do so. Email webinars@lsvtglobal.com to receive your certificate after the webinar is done. And for on demand, similarly, you'll be able to email us if you have any difficulties, but the instructions for certificates on those watching this after today on demand, there is a survey link that can be found below the webinar description of the individual webinar in the on-demand section of the website. And there's that address, the blog.lsvtglobal.com. Or you can also find it in the webinar description under the video in YouTube if you're viewing that way. So that's sort of some of the logistics about today and the webinar. For those who are pursuing non-registered CEUs for this hour together, attendance for the entire hour is required to earn a certificate. All right, so let's talk more about today, the learning objectives. At the end of the webinar, we plan for all individuals attending to be able to identify at least 2 reasons that treatment should be personalized. I think this is important across all types of treatment and therapy, but we'll be speaking specifically to LSVT treatments. Number 2, you'll be able to list the standardized components to the LSVT treatments, and you'll also be able to list the areas, number 3, where LSVT LOUD and LSVT BIG can be personalized, which I think is the most fun and enjoyable part of the therapy for everyone involved. And number 4, you'll be able to name the flexible adaptations for LSVT treatments. Now, we often have a wide range of individuals who are joining us for our Wednesday public webinars. And so I want to find out who's here. So I'm going to be launching a poll. It should come up for you here in just a moment. We want to know who is joining us. And so there are your options. If none of those fit nicely, you can have the other option. I'll be launching this poll and give you a moment here to look at your choices. Are you a person with Parkinson's or another neurological condition? Are you a family or a friend, caregiver? Are you an LSVT LOUD or LSVT BIG certified clinician? Or maybe you're a non-certified health professional or student. Excellent, we're getting in. I love watching the bars change as the poll is going. So I think everyone has responded. I'll end the poll and share those results. So it looks like the majority of folks who are joining us are people with Parkinson's or other neurological diagnoses. And then we have some therapists here, both certified and non-certified LSVT. So it's great to have everybody here, and this really helps us also to be able to sort of tailor and talk about our slides with our audience in mind. So thank you so much for completing that for us. All right, so if you are a person with Parkinson's disease, I have some questions for you. Do you find people asking you to repeat yourself, or maybe they're leaning in to hear you when you speak? In your walking or in your movement, do you find yourself always lagging behind a bit? Or do you notice that things like getting ready take longer than they used to? We see and hear these types of symptoms from our patients every day. And so LSVT LOUD is going to address soft speech that is harder for others to understand. And LSVT BIG is going to address these smaller movements that have maybe changed your, not only your amplitude of movement, but also the walking pace, the slower getting ready, those things that you may be noticing. But these treatments, so we certainly recognize that there is a movement disorder aspect, and that's why speech gets softer, movements get smaller, pace of walking gets slowed. But I really need to point out that these treatments also address more than just the movement disorder. These treatments must also address the sensory disorder that occurs with Parkinson's. The internal cueing, even when you know you need to be loud or you need to walk in a bigger step, the internal cueing to be able to actually do that is affected. And these treatments also must address, for many, memory, motivation, mood, and effort changes that occur. Why must we address these other elements? Well, Parkinson's disease is a movement disorder, and most of us are familiar that the movement hallmarks of Parkinson's disease include slower movement, known as bradykinesia, smaller movement, known as hypokinesia, and these things make it more effortful to move and to speak. But some of us might not be aware or might need reminding that Parkinson's disease is also a sensory disorder. The hallmarks of it being a sensory disorder include the fact that movement might feel normal to you, even though it's actually gotten very small. And it may manifest as when you are speaking to your ear, your voice sounds normal. It sounds perfectly adequate, when in fact it is too quiet. So what are these implications of the fact that there's this sensory disorder? Well, what occurs is a mismatch between what you perceive and what is actually coming out. And so when you do move bigger and others tell you, that looks great, it looks really normal, it feels too big to you. There's a really good analogy that a patient had of, when I walk like this, I feel like I'm the Pink Panther. If you think of those Pink Panther cartoons or the Pink Panther walk from the movies, this big, exaggerated, and funny looking walk. That's how it might feel inside to the individual with Parkinson's disease, when in fact, everybody watching you move big says it looks totally normal. On the speech side, how this manifests is that when you talk at a normal volume, the volume that you had before Parkinson's disease, it actually feels to you like you're shouting, and that feels uncomfortable. Doesn't feel like it's our personality. We worry that people might think that we're angry or mad, but in fact, we're not shouting. It's an absolutely normal volume level. It also means that there is a lack of self-correction because you cannot adequately or accurately perceive the small movement, the soft voice, there's a lack of self-correction. So how can we achieve addressing these multiple areas of Parkinson's disease in treatment? Well, how this is accomplished is through well-researched, effective, efficacious treatments. And that's where LSVT BIG and LSVT LOUD comes into play. The standardization of treatment protocols includes specific dosage of the therapies and a treatment schedule that are research-backed and to be known to be efficacious. And so LSVT BIG and LSVT LOUD are standardized treatment protocols. And this is where the standardization of 16 sessions, it's 4 days a week for 4 weeks. All of the sessions are individual, one-on-one with a therapist and last for an hour. There is daily homework practice that occurs and is a must. It has to occur in order for the efficacy of both treatments to really be met. And there's also carryover exercises, these opportunities for you to practice these new movements, this new voice in your everyday life. So, how is your therapist going to help you in the treatment session? So this is what's going to be targeted. There's daily exercises that focus on amplitude. Amplitude is this notion of bigger. So it's going to be a louder voice. It's going to be bigger movements within your body, your limbs, your trunk. And these are accomplished through exercises that target amplitude of voice and movement. They also target movement and voice range of motion and everyday function. You should always feel in your treatment sessions that, and yes, you will exercise, but you should absolutely feel that your treatment is individualized and it is tailored, and that this second component of treatment, where we get into individualized, tailored speech and movement tasks, are meaningful to you. And so, for example, if you are interested in gardening, this might look in LSVT LOUD treatment as talking about, reading about, having dual tasks in your exercises that are related to gardening. And in LSVT BIG, that you are doing the functional tasks that look like the movements you make while gardening. Maybe practicing getting up and down, balance that you need in order to pull a weed, or maybe fine motor tasks for sorting seeds that you're going to be planting. And these are going to be delivered and shaped in ways from your therapist that are the best and the safest ways for you to speak and move. And this is going to be elicited, it's going to be shaped for what you, the individual, needs by clinicians. And we also systematically build up your strength and resistance over those 4 weeks of treatment. And we retrain your sensory perception and your internal cueing, so that if you know you're being quiet or you know you're moving small, that internal cue to fix it and change your behavior is established and is successful. So let's talk about homework and why this is important. Why does it matter to do homework? So outside of the treatment room, the protocol for therapy continues with homework, because we want you to have extra practice outside of the time in therapy. By you practicing outside of the therapy room, the treatment protocol continues, because simply being successful in therapy with your PT, your OT, your speech treatment, that's great, but that's not the end goal. The end goal is that you are successful when you walk out the door from your treatment session. We also want to build up a routine so that you'll continue to practice post-treatment. So, for examples, in LSVT LOUD, folks doing their exercises in the car when they're driving or when they're being driven. That's an example of somebody working that into their routine. They're in the car every day. They do their practice and exercise in a really approachable way that fits right into their day. It's part of their well-established routine. And also that these are going to promote further comfort in using loud, in using big in your everyday life. We want to make you comfortable with the exercises and with these loud and big movements so that you're actually practicing and you're getting an extra opportunity to know your voice and your body are moving in very normal ways, even though it feels like you're too loud, even though it feels like you're too big. We know that you have to be comfortable in your own skin, and to get that confidence in these bigger voices and bigger movement, it's going to take talking practice, moving practice in those healthy ways. And in order for that comfort to occur, it takes practice outside of the therapy session. We also accomplish this through carryover assignments. And so your therapist will assign you this new way for you to practice your louder voice or bigger movement in your daily life. And this occurs all 30 days of the month that you are with us for treatment. It's not just over the weekend. It's not just for some of the sessions. It's for that whole month. This is really where the rubber hits the road, where all these great exercises, this practice, this meaningful tasks that you're doing within the treatment, this is where it hits the road and lets you have that opportunity in your real life to speak in an intelligible way and to move in a safe and efficient way. We see, though, that these carryover tasks have got to be important and specific to you. If they aren't meaningful, the outcomes are not going to be as strong. So they truly do have to be about you, what you're doing in that given day, and they have to fit in with what is important to you and your goals. These are also going to systematically increase in their endurance, their length, their complexity, etc. So that way we build up your confidence and your comfort over time using this bigger and louder voice and movement. How this might look, and it's going to be personalized. So for example, somebody who is perhaps still in the workforce, maybe in week 1, it's simply making introductions to a new client. The therapist knows you're meeting a new client. We don't expect you to hold, a whole hour-long conversation with this loud voice. It may instead look like, do that loud voice in your introductions. Maybe in week number 2, it's giving data at your meeting, and those are going to be sentence long. By the end of treatment, maybe we've worked you up to giving an entire presentation that you were responsible for at work. Perhaps somebody who is young onset, they're the parent of school-age kids. We may work up from phrases at like the level of knock-knock jokes that they want to tell their son because their son loves knock-knock jokes. Maybe in week 2, it's reading aloud sentences from a board book, the books for, the younger kiddos. And then maybe at the end of therapy, it's carrying on a conversation with their teacher at parent-teacher conference night. A grandparent who is living at a skilled nursing facility, their tailored tasks that are meaningful to them may include greeting their family when their family comes to visit in those early weeks. It's nice and short. It's achievable. It's something that they can practice with, start getting that comfort. And then maybe we progress to asking the CNA for assistance. Something very functional, helps with comfort, helps with safety, but is a little bit longer, asking for those requests. And then at the end of therapy, it may be working up in those carryover activities such that it's holding a conversation at the lunch table about your joy for gardening, for example. And that same build-up and hierarchy will be similar to the LSVT BIG side of the change in amplitude, the carryover of that new, bigger movement in your everyday living. And so you might be wondering, how can a protocol be both systematic, structured, high-intensity workout, have multiple repetitions, be specific to you, and be complex where it never is boring. You are never going to be bored in the month of therapy because it's going to be salient and meaningful to you. So how can we have that in the light blue bubble coexist with what's in the dark blue bubble? That it is personal. It's fitting your strengths and your challenges, because everybody's different. Even with the same diagnosis, everybody is different. We want this to be applied to your everyday life and to keep you motivated to communicate and move. And so to answer that, Jenny is going to take us through that all-important aspect of personalized standardization.
Thanks, Heather. All right, well, I will pick up here. And again, if you weren't here at the very beginning, I'm Jenny Tacito. I'm the other instructor for today. And where Heather's expertise is on the speech side of LSVT LOUD, I am on the physical and occupational therapy side of LSVT BIG. So I'm going to share a little bit about what Heather set up so nicely is like, here's the protocol. Here's what we know. This is how we know the effectiveness, because there is a protocol. There is some standardization to the treatment that allows us to have research and evidence behind the effectiveness of it. But within all of that, there is so much that we can do to personalize within that standardization. So really, we've got this core piece of LSVT BIG and LSVT LOUD that has over 30 years of research and evidence behind it. And what is really at the heart of that is its effectiveness, because we can stand on that research, that evidence, and that history of these programs. However, as a clinician who's treating people living with Parkinson's disease or other disorders, you have a lot of flexibility in how you tailor that treatment session to your clients. And then as a patient receiving the treatment, there's a lot of tailoring that is done for you to personalize it, to bring in your needs, your wants, the things that you need to improve upon, and make those sessions very personalized to you. There's a reason why these treatments are not delivered in a group setting, because they are meant to be one-on-one, individualized, addressing the issues that you are experiencing and that your therapist works with you to identify. Your therapist is going to work to meet you where you're at. So if you're doing relatively well, but there's just a few little things you're noticing, let's address those small things before they become big things and become big problems. If you're someone who has more advanced disease, there's more going on, your therapist will really work with you to find out what are the most important things you really want to be working on, and we'll focus on those things. And then we're going to make the exercise and the treatment fun and meaningful. And I think when we talk to our volunteers that volunteer with us for courses, that's always something that comes up. Is they're more likely to participate and be a part of something if it's fun and engaging, and they can see the functional impact on how this might help them. So we really bring that all in to that standardized treatment session. So this next slide is really going to look at a chart view of what is standardized and what is flexible within those treatment sessions. So we'll start with kind of the standardized piece, that there is a standardized session duration and a minimum number of sessions. And to put it in this way, think about that as your dosage. Like you think about a dosage of medication or a dosage of like a treatment, a radiation treatment, cancer treatment, things like that. The research and the evidence shows that there's a certain amount of dosage that you need in order for the treatment to be effective and reach its maximal outcome potential. So those are some things that are standardized in this treatment. Is we have that standard duration of 60-minute visits. The minimum number of sessions is you're going to be seen, or you're going to see your patients 4 times a week for 4 weeks to get those minimum number of 16 treatment sessions in. We also have this unique feature of a singular focus of amplitude. And what amplitude looks like in voice treatment is think loud, utilize a louder voice. What amplitude looks like in the LSVT BIG treatment or movement is to think big or move big. So we're trying to get larger amplitude of both fine motor and gross motor movement patterns. And then within that, there is a prescribed homework program. It's the same things that are done in the treatment. So there's not a guessing game on what that homework is. And then we have carryover assignments where you're asked to go and, have a conversation, make a statement, do something big after you leave therapy, which Heather highlighted earlier. And then Heather so nicely also highlighted that idea of sensory recalibration, that our goal is to retrain that internal cueing system so that you know and regulate how to use that increased loudness of voice or that increased bigness of movement on a normal basis, and how to practice it enough that it eventually feels more usual or more normal for you again, that it doesn't feel so effortful to speak at that volume or to move at that size. So that is standardized. Those things are all a part of what we know from the research and evidence. But then within that, we have those flexible adaptations where all the goals are individualized. We're going to work on what you want to work on. We're going to tailor the exercises and the function focus to fit you where you're at. We can adapt the treatment techniques if there are cognitive issues or physical challenges that we need to work around. We can apply this to a variety of treatment settings. So no matter if you're in an inpatient setting, an outpatient setting, being seen in home care or mobile practice. Also, we're going to individualize those connections to daily life for calibration retraining. So really making that connection between what you're doing in your therapy sessions and how that's going to impact you outside of therapy. So as far as individualized goals go, we're going to really tailor those long-term goals to communication and movement. And this is a collaborative effort between client and therapist to really determine what are those long-term goals, and then kind of rein in those long-term goals into something we can kind of package into, here's our long-term goal, this is what we're going to do to work on it. And really looking at all of your roles in life, thinking about the things that you're involved with. Are you still working in a paid position? Are you volunteering? What do you have to do to complete your activities of daily living? How are you involved in your community with volunteering, different activities, exercise events, hobbies that you might have? And what kind of interactions are you having with loved ones and caregivers that you would like to see improve or change or do differently, or things you want to be able to go back to that you've maybe felt like you can't do recently? So we're going to really individualize those goals to fit you and where you're at this moment in time. Then how we're going to do that really is through this personalized approach to treatment. I really like this statement on this slide that one of the key strengths of LSVT BIG and LSVT LOUD is the ability for it to be tailored to each person's abilities, needs, complexities, and goals. So there's so much personalization that is happening within that treatment session once we've decided, like, this is what we're going to do, this is what we're going to work on. And I'm going to take you through each of those in a little bit more detail. So let's start with talking about the LSVT exercises. If any of you are familiar with LSVT treatment, this is kind of the first part of a treatment session. We're going to work on those LSVT exercises. Now, there is somewhat a standard set of exercises where there are certain speech exercises that you are going to practice with, like your sustained ahs, your highs and lows with those. With LSVT BIG, there's a set of 7 different movement exercises that are a part of that. So that is a little bit standardized. Like, we've got a subset of here's the exercises we're going to do with each individual. But with LSVT LOUD exercises, that effort, that volume, that tailoring and cueing is all going to be scaled in intensity to your individual needs. So what your therapist might have a goal in mind of, I want you to be able to sustain phonation for this amount of time and this intensity, but maybe we're not there yet today. Today's a bad day. It's not going as well. They're going to tailor those exercises and that treatment to fit you or meet you where you're at in that moment, that session. And we know each day could be a little bit different. So they'll adjust as they need. Same with LSVT BIG, is we can adapt that standard set of exercises to be done in a variety of positions to ensure that you feel safe, confident, and are successful in what you're doing. If you're losing your balance constantly, it's really annoying, right? It's really frustrating to lose your balance. So your therapist might be like, okay, we're going to try holding on to a chair for some of these reps, or even let's try them in sitting. And they can be done lying down as well if none of those other options are safe or effective. So your therapist will adjust those exercises as needed. They will also adjust the repetitions of the number of exercises. There is a standardized number that we have a goal of doing, and that is based on the research and evidence. But if today is not a good day or it's hard to get through that number of reps, we can decrease that number of reps to fit you where you're at. Or if you're someone who's like gets to 8 reps of something and you're like, oh, that was too easy, I'm hardly working, beware, your therapist is probably going to ask you to do more. So we'll adjust those numbers of repetitions up or down based on what you need that day, where your tolerance, your stamina, all those things are at. But I really want you to know that LSVT is so much more than just exercises. And I think this is something that's really highly misunderstood. People think they can just go find a video of the exercises, the loud exercises or the big exercises, and follow that video. And I've had treatment. That's it. That's not the case. And I hope if you're new to this, you're starting to kind of understand that those exercises are a small piece of a treatment session. The other parts of the treatment session are going to really focus in on personalizing for you the things that you need to be working on functionally, whether that is functional communication, such as having conversations with people, participating in different activities at home or in the community, being able to be a part of your hobbies, your volunteering, your work-related tasks that you're a part of. Maybe you're someone that, doesn't do a lot of long speeches, communication. We're going to focus on those smaller phrases, that more social communication. Maybe you're someone who's working or volunteering and often needs to speak or lead a group. Maybe your communications are a little bit different. Your communication needs are a little different. So we're going to tailor it to you. As far as the LSVT big side, the physical and occupational treatment, we're going to focus on those functional tasks that pertain to your daily activities. And what I mean by that is like, what things do you do in a day that are getting difficult? You're needing more time to do. You feel clumsy. They're slower. Your accuracy is decreasing. We're going to talk about those things and how we can bring amplitude to those functional things. So we're going to talk about things like getting out of a chair, transferring out of bed, getting in and out of a car, putting a seatbelt on and off. Maybe it's getting dressed, getting out of the house to go to a medical appointment, visit grandchildren, care for grandchildren. I mean, the list goes on forever. There are so many things we can work on. So we'll work with you on figuring out what those things are and how we can tailor those to your needs. And how we're going to do that is really by starting with conversations, exploring those interests, those hobbies, those goals, the things that you want to improve upon, and learning, like, once we do identify those things and start practicing, how can we layer in other things to continue to make it challenging for you, to have you continue to work harder as you progress across those weeks of treatment. I've been many times had patients said to me, well, you're not satisfied yet. That's not good enough. And no, I want to see you be able to not only stand up out of a chair in your living room when no one's watching. I want you to be able to stand up out of a chair in a busy restaurant while you're talking to your daughter, and dual tasking, motor or cognitive dual tasking. Same with, speech, as I want you to not only be able to talk to your spouse in your quiet home, but I want you to be able to,
and they be done
my
concurrently?
computer is talking to me now. All of a sudden, that was weird. Hopefully you hear that. But as far as speech goes, I want you to not only be able to talk to someone in your home when it's quiet, I want you to also be able to have that conversation in a busy restaurant. So think about those things and how we're going to make it more difficult as we go. We also highlighted a little bit about needing to adapt to cognitive or physical challenges, which are a real thing in our day-to-day life. So we want to be able to tailor it to where you are and what you need. So if there are cognitive challenges that are present. Maybe it's short-term memory. Maybe it's, difficulty remembering to do your exercises. We're going to talk about how we can work through some of those cognitive challenges. One thing that's really great about LSVT treatment is there is simplicity in the target, meaning that we have a single focus of amplitude, which is speak loud or move big. Repetition of exercises is also super helpful. We're going to do the same exercises from start to finish. We might make them harder. We might do more repetitions eventually, but it's consistent exercises, so they're easier to remember. And then you get that familiarity through that consistent cueing for amplitude, that shaping, that guiding, that movement. We drive that idea of saliency, which is doing things that are important to you by choosing personalized activities and treatment materials and providing any aid that we might need to ensure that there is success outside of the treatment session. So we have a wealth of resources that your therapist can provide to you to help as a caregiver know how to make this most effective outside of the therapy treatment room. We also can focus on treating through the versatility in the symptoms. So there may be a variety of fluctuations day to day. There may be some days that aren't great, some days that are better, and we can be versatile in adjusting our treatment, our cueing, and everything to address that. And beyond that, the single focus of increased amplitude trains a variety of things beyond just loudness or bigness. So thinking about too, how the cue for loudness is going to help simultaneously improve voice quality, articulation, speech intelligibility, facial expression, and communication confidence. So we can see this spread of effects to a variety of different things. LSVT BIG can also address things beyond just amplitude. So we're working on balance, agility, speed, posture, coordination, endurance, and flexibility, all within the treatment plan and the focus on amplitude. Another way that we have a lot of versatility and personalization is that the treatment can be delivered in a variety of different locations or types of therapy environments. We have therapists that are certified all over the world that are providing LSVT LOUD and LSVT BIG in outpatient private practice clinics, university clinics, rehabilitation clinics like hospital-based outpatient, home health or mobile practice, which mobile practice is more where they see patients with Medicare Part B in the home. We are seeing pediatric application throughout school systems with people living in skilled nursing facilities or assisted living or senior living communities as well. And we can also bridge the gap between these environments. So if you're starting with an LSVT certified clinician in one area, say you're in an acute stay or in home health, and you're getting too good for that, and it's time to graduate out of that, you can extend and continue that LSVT treatment as an outpatient or maybe through a mobile practice in different environments like that. Over the long term, over the long term, we also want to be thinking about how do you sustain this? How do you keep it up over time? How do you sustain what you've learned in therapy when therapy is over? So we also focus on this idea of this long-term maintenance plan and how are you going to stay up to date and exercising and maintain those gains that you did? Well, we want you to continue your exercises beyond therapy. So once you're done with LSVT LOUD or LSVT BIG, you're going to continue to do those exercises on your own daily forever. You're going to do your own home practice of those big exercises or those loud exercises. Your therapist is then going to guide you into when it's time for a tune-up. So they might want to check in with you every 3, 6, 12 months to see how you're doing and see if more intervention is needed. Think about that like you think about going to see your dentist or your physician, where you're going in for your annual checkup and they're going to let you know if any further testing or interventions needed. Think of your therapist in that same way. Beyond that, If you're someone who likes to join groups or other types of exercise, we highly encourage you to do that. So we want you to join group exercise classes, and we do have Loud for Life or Big for Life classes that you can be a part of. Therapists, once they get certified in LSVT Big or LSVT Loud, can take a training on how to lead a group fitness class and lead those Loud for Life or Big for Life classes. LSVT Global even has their own virtual platform if you don't have that class option in your community and you want to do virtual classes. So there's lots of ways to get involved with those weekly classes. And then beyond that, we really highly encourage you to get involved in other community-based exercise. So if you like to sing, there's singing groups out there. If you like to bike, or there might be different gym classes, that you can go and do some fitness classes that maybe aren't LSVT Big or LSVT Loud, but they still address that amplitude-based stamina endurance piece that you enjoy. The more advanced the diagnosis is, the more often we might want to see you for those tune-ups. The less advanced it is, the longer we might go between periods of time. Everyone is encouraged, though, to check in whenever they feel like it's necessary, even if it's before that 3, 6, or 12-month checkup that your therapist recommended. Then we want to talk about the application beyond Parkinson's disease. So both of these treatments were initially developed for treatment of Parkinson's. But since that time, there has been a lot of research published and evidence out there, case studies, small group designs that have looked at applying it even beyond Parkinson's disease. So if you're thinking, as you're a therapist, thinking about taking this course and you're like, well, I don't treat a ton of Parkinson's, but I see it a little. Do you treat other neurodiagnoses? Do you treat pediatrics? This treatment has been shown to be effective across a wide range of diagnoses. So there's so much adaptability in being able to apply this to a variety of diagnoses. These are just a few areas that are ideas and places they could be applied. We do have a LSVT Loud for Kids course now, based on the research that has been published on application to children and adults with cerebral palsy or with Down syndrome. We have also seen it applied to people who have MS, not in an acute exacerbation, but in a stable point in their diagnosis, post-stroke, general aging, voice and balance, and many, many more. Of course, the atypical Parkinson's, and all the things like that. But just like each person needs and deserves tailored treatment, each diagnosis comes with its own unique needs and presentations. So as a certified clinician, you are going to learn how to adapt the exercises, the techniques, the different parts of the treatment session to address the individualized needs of a variety of diagnoses, even beyond Parkinson's disease. So we also want to just highlight that everyday flexibility, which I touched on a little bit before, where we know some days are better than others. The therapist is going to adjust things based on that. There's also these on and off periods that can come with medication variability. We, of course, will adjust for that. We will make sure that we're meeting you where you need to be, challenging you appropriately for that given day, and add in those real world complexities, that multitasking, dual tasking, to ensure that you can not only complete these things in a quiet room by yourself, but you can actually be successful in the community, in your environment, and with all the activities that you're involved with. So I'll do a little summary, and then we'll take some time for questions after that. Really, what we wanted you to get out of this is thinking about LSVT Loud and LSVT Big as a structured protocol with individualized care. So within that structure, the personalization that takes place in order to address the specific needs for every patient. Yet we want to maintain the scientific rigor and consistency necessary for those outcomes. We are a company that prides ourselves on educating people based on the evidence. So we are going to tell you what we know from the evidence, what we recommend based on that evidence, and then allow you to personalize within that evidence-based structure. This paradoxical approach allows for a standardized yet flexible treatment that can be adapted to the diverse and changing needs of people with Parkinson's disease, other neurological conditions within adults, and pediatric diagnoses as well. So we are going to take some time to answer some questions. Heather highlighted earlier that there's a variety of ways you can ask questions. You can type in the Q&A box on your control panel or potentially in the chat as well. If you'd like to ask your question out loud, you can click to raise your hand. We can unmute you to ask questions. And of course, if you have questions that come up after the fact, you can email us at any time at webinars@lsvtglobal.com, and we will be happy to answer those questions. A little note before we move on to questions is after we're done with this today, or at any point you leave us, a survey is going to pop up for you to answer some questions. Please take a moment to just fill out the survey. We do use those survey results to design the next year's webinars. So it's almost the end of 2024 and we're going to be planning for 2025. So if you have questions, topics that you'd like to learn more about, please let us know in that survey, and we'll, of course, consider those for our next year's topics. It should be super short. And then if you've not yet heard, we launched a podcast this year in 2024, and I think it's pretty amazing, but we have a variety of guests on that podcast, anywhere from clinicians to Parkinson's advocates, people living with PD, a huge wide variety of topics that we've covered in that podcast and will continue to cover next year. So you can check it out on our YouTube channel. You can use Spotify or anywhere that you guys get podcasts from, Apple Podcasts, any of those places you can find it. It's called Think Big and Loud. So check it out if you get a chance. All right. So I'm just going to take a moment to say thank you, and then I'm going to turn it over to Heather here to see if we had some questions come in while we were talking.
Wonderful. Thank you also from my heart as well. And Jenny, that was amazing. It's such good information and also really great examples of how it truly is a personalized protocol. We've had a question come up in the chat, which I think is a really good question and also absolutely pertains to this idea of personalization of treatment. And so it was asked, is there a preferred sequence to do big and loud, or can they be done concurrently? And so, as I alluded to a little bit, it is a personalized answer that I'm going to give you. It really will depend on the individual. And so for some patients who come in, I had this happen when I was working in the outpatient hospital, where we absolutely had patients come in who came in for the evaluation for loud, came in for the evaluation for big, and we treated them in the same month. Those were individuals who were up for it. They had the capacity within their schedule. Some people don't have the capacity for 2 hours of treatment within their daily schedule. And some maybe don't necessarily feel they have the endurance for that. But there are patients who will do this concurrently, and that's absolutely appropriate. We will get together the speech side and the LSVT BIG side. We'll get together and discuss with you, with your, if you need transportation, if you have people coming, dropping you off or waiting in the waiting room with you, we will be evaluating within that treatment session what your needs are. And so for those folks who do it concurrently, we usually also try to mix up who you're seeing first on a given day. I always liked to have some of my sessions first before they went to LSVT BIG. And I like to have some of my sessions within that month of treatment where I saw them first. So that way we weren't both, one person wasn't getting, a tired out patient who just had an hour of exercise. They could come to us fresh, or they could come to us after having had a workout with the opposite discipline. So concurrently works for some people. It doesn't work for all people. And so for those folks who are going to do one treatment first initially, and the next treatment and the next month after they've graduated from their first LSVT therapy protocol. There's no preference. It's not like you must do loud first and then do big or vice versa. This is also going to be determined by meeting you where you're at. If you are somebody who, your communication is really something that is being impacted, you need to improve communication for safety or for your job. That example I gave of somebody who is in the workforce and they are expected to make presentations, or for the individual at the skilled nursing facility, and they are really motivated to want to have lunch with their friends and be able to talk about gardening. The range within that. If those are your major goals, we want to keep that in mind. And so maybe you'll have loud first. Or on the flip side, if your major symptoms have to do with movement, or if you're very concerned about falling or your balance, you maybe loud is not the most pressing of your needs and your desires and your everyday goals, your functional life, then big is absolutely what's going to be appropriate for you to have first if you're not doing it concurrently. So that's a great example of how it, even at the time of assessment, if you're interested in both therapies, you have those orders for both therapies, those clinicians are all going to get together. They're going to brainstorm. They're going to take your goals and your input into consideration and come up with that treatment schedule. And then sometimes there's just scheduling. It's convenient for you to do this because the LSVT BIG therapist has openings in their schedule, but maybe the loud therapist is booked up, or vice versa. So there's a lot of nuances to that question. I'm so glad that you asked it. It's a really good one. All right. And if you have any, here's a question that came in. Perfect. I live in the UK and work independently as a physiotherapist. Are there other clinicians practicing in the UK that possibly connect with each other to support consolidation of skills if learning the LSVT approach, or any other connection regarding further training, etc.? So Jenny, I'll let you take this one. I know it's an exciting answer. So.
Absolutely. Yes, there are definitely other clinicians that are LSVT BIG and LSVT LOUD certified living in the UK. A really easy way to look and see where there are people, if there are anyone in your area, is to use our Find LSVT Clinicians tool on the front page of our website. So if you go to lsvtglobal.com, up in the upper right-hand corner, there's this orange or red button that says Find LSVT Clinicians. You can put in your area. If you're in the United States, zip code works the best. If you're in another country, typically like country and city, or postal code, things like that. There's some descriptions there on how you can search. And then set your radius in which you're looking to look within. That'll allow you to see where there are other certified clinicians. Anyone who shows up on that search is an active clinician, meaning they've maintained their active status with LSVT Global, with doing their recertifications and everything like that. But that would be a really great way to see where there are other clinicians. And then it would be the same thing if there's anyone listening right now who's interested in finding someone to provide the treatment to them. That same search tool is the best way to go in and look and see if there's someone in your community. And an exciting piece to that is that search tool is going to be upgraded and updated in 2025. So we were hoping to push it out before the end of the year, but we've decided to wait until after January 1 so that we can push it out when there's actually staff in our office that can help if something goes wrong. So it'll be more of like a Google type search now, with like a map with pins on it that you can look also. So look for that update in the new year.
Oh, that's so cool. That's really exciting. And I love the aspect of being able to look for clinicians as a patient from that point of view, and also looking for clinicians as another clinician. That community is so really important. And that's something that we truly pride ourselves in. That's something that we strive for, is that both patients and clinicians do feel like there is this wealth of knowledge globally. It's a global community for sure. And
let me add one more thing to that. If there are any therapists, PT, OT, speech that are listening, maybe also from another country, is our courses are open to people anywhere in the world. So we do have the online LSVT LOUD or online LSVT BIG certification course. That's a work at your own pace. So no matter what time zone you're in, works really great. And our virtual live courses are open to anywhere from around the world as well. So if you're looking for additional training or information, courses can be accessed anywhere in the world.
Perfect. That's great. And a really important, I think, aspect to share. So thank you so much for joining us. We don't have any other questions that have come up, but as Jenny mentioned, we're here. And so if you have a question that comes up later, we can be emailed. You can also access the LSVT Global website. There's a number of webinars on demand. There's forums. There's a lot of great resources for both patients and clinicians alike. And so with that, I will say thank you so much for joining us. It's really been a pleasure. And I hope everyone has a wonderful and safe new year. And we're excited for even more opportunities to be with you all in 2025.
Thanks, everyone.